my name is Brenda Herman, and I am now nearly 8 weeks in after a hip replacement which occurred in early June 2014. I came to the what you call the pre-admission thing and got all the tests done, and the nurse I saw there said that there would be a joint school, and she told me there would be probably a 6 to 8 weeks waiting list before the operation. Anyway, about a week afterwards, I got a phone call to say there had been a cancellation if I wanted to accept it, which I did. And she said there would be a joint school on the following Thursday if I wanted to go to that, which I went to, and was extremely informative and helpful. It was a nurse and the physio that gave the talk, and it answered a lot of questions really about what you would expect during the stay in hospital, and how you would expect your recovery to start off when you went home. And yeah, I found that very, very helpful, and it eased a lot of anxiety really. I came in at 7:30 in the morning for admittance, and everything moved very quickly from there. And then a nurse arrived with all the forms to fill in for admittance, and then the consultant, he came in with the forms and went through all the pros and cons of what may or may not happen and all the rest, and it went very fast from there. I was given a gown to put on with all the holes for the heat tubes and whatever, and within about 5 minutes the anaesthetist came in and gave a very clear explanation of what he was going to be doing, that it would be an epidural, and if that was unsuccessful it would have to be a full anaesthetic, but he was hoping that that would work. And then he left and a nurse came in. I put on the gown and we walked from the admittance room to the theatre. So from coming out of theatre, you're taken into recovery, and you were aware, I knew what time it was, and I was actually given, because I'd walked down to theatre, so I was given my shoes back to take back to the ward. That's the first sort of piece I remember properly. And I was in recovery for probably about quarter of an hour, 20 minutes maximum, and then taken back onto the ward unit, and felt quite comfortable and very pleased it was over with and was okay. And within about half an hour I was feeling fit enough to have a piece of toast and a cup of tea. So no, I didn't really feel anything at all. I mean, I could sort of feel where it was, but I had the wedge between my knees, and then when they put me back into the bed, they put these pressure, whatever they're called, around your lower legs, and they keep your blood circulating and that. And I got quite used to them. It was quite a nice feeling once you got used to it. And I was expecting that I might feel sick or whatever, and I didn't. I was pleased that it was better than expected. Probably by about 7 o'clock, something like that, I would think it began to fade and I could begin to feel it. They kept coming back and asking me to move my feet and see where the feeling would come back into. Yes, that was the thing that scares you really, that that it might just pop out or dislocate. So you're very rigid as to how you lie, because you don't want to move it, and to bend your knee up at all, or dreaded to cross your legs. After 67 years of doing it as natural, it was very, very odd, and to be perfectly honest, it still is. not to do that, but we're getting there. Yes, but that was, I must admit, that was quite an anxiety, thinking, you know, what if I forget and cross my legs and the whole thing comes out, but it doesn't happen. You know, it just doesn't move that way. The only thing that disrupted it really for me was I had a low blood count, and I'm still anemic now. So when I first started to get out of bed, it wasn't the hip that was the problem. It was just the blood pressure would drop, and I just sort of went faint and was a bit woozy. Yeah, I envisaged that the stairs would be a real problem, and how was I going to deal with these? But I was astounded that stairs are so easy. It's much more difficult actually getting onto your feet from the bed or from a chair than it is walking up or down a flight of steps, which still amazes me, really. Yes, so it was good. I'm reasonably squeamish, I suppose, so when you've got a cut down your side, I was thinking, oh, you know, what if it leaks, or what if something happens after I go home and I don't have staff there to deal with it. But it all healed up very well, and I didn't need any assistance at all, apart from sleeping. Yes, well, I was supposed to go home at 4 days, I think, and then because my blood pressure was low, I had to stay in for an extra day just to get that back on track. I knew that I had the contact number. I went home with my bag of pills and potions and all the rest of it, and it worked well. I have a long car journey too, because we lived at Grange at the time. So it's sort of 40 minutes, 45 minutes car journey, which I wasn't looking forward to again, with bumps and all the rest. But it went okay. It wasn't a problem at all. Getting in and out of a car is a whole lot more difficult to start off with. But as days go by, it becomes easier. The pain control while I was in hospital was absolutely superb. I mean, you just don't really feel pain because they're there before the pain kicks in, so they keep it suppressed, and I was very impressed with that. I was expecting it to be a whole lot more painful than it was. You had the injections in your stomach for the first 2 nights, and then you're on pills, which I was on for 30 days, and now I'm back on my low-dose aspirin as I was before I came in for surgery. Yes, so that all went okay. The only addition I had was the iron pills for blood, but apart from that, it's all gone now. Because you go from being completely cocooned in staff and monitored every 3 to 4 hours to you're home alone, and that was a big step, I must admit, and I was nervous for the first couple of days in case anything goes wrong, you know, if you had a trip or anything. Anyway, fortunately, nothing went wrong, and I'm sure it doesn't with most people, but I was anxious the first few days, and then of course it becomes normal, like anything else after you've done it a couple of times. So yes, it was really good.